Hi everyone, this is Dr. Gajandan, consultant general physicians from Sri Lanka. Today I am going to discuss about microvascular diseases in diabetes mellitus. If you or your family members having diabetes mellitus, this video is for you all. This microvascular disease is often going unnoticed, but if ignored, it will cause serious complications. So we should have a sound knowledge on how to detect microvascular disease early and how to protect ourselves from these serious microvascular complications. As the name implies, micro means small, vascular means blood vessels. So this is complications from diabetes mellitus that affect small blood vessels in the body, especially eyes, kidneys, and nerves. Diabetes mellitus not only increases the blood sugar levels in the blood, but also it causes changes in the blood vessels throughout our body due to the metabolic derangements. These microvascular complications can be divided into three. First one is diabetic retinopathy. The second one is diabetic nephropathy. The third one is diabetic neuropathy. First, we will discuss about diabetic retinopathy. Retina is located in the back of our eyes. So when the blood vessels in the retina is affected due to diabetes mellitus, it is called diabetic retinopathy. It may be silent at the beginning, at the time of diagnosis, but it may be manifested in the form of reduced vision, floaters, sometimes sudden vision loss. So obviously we have to diagnose it early, especially with retinal screening with the help of ophthalmologist. It is usually recommended to do the eye screening at the time of diagnosis in type 2 diabetes mellitus patients. Then annually, all the patients should undergo retinal screening to detect the diabetic retinopathy early, and if necessary, to undergo any therapeutic interventions like laser treatment. Next, we will discuss about diabetic nephropathy. Kidneys are like filters. So they are helping in cleaning our blood. So when the blood vessels in the kidneys are affected due to high blood sugar, it will result in diabetic nephropathy. It is usually asymptomatic, except in the advanced stages. So we have to detect in the early stage by doing some investigations, especially some blood investigations like serum creatinine, urine investigations like urine full report or urine albumin creatinine ratio may detect albumin leakage in the urine due to the affected glomerular structure. high serum creatinine may indicate reduced renal function. If those abnormalities are detected, we can prescribe some medication to delay the progression of diabetic nephropathy. So we have to do these blood and urine investigations at least once a year to detect these complications in the early stage. Finally, we will discuss about diabetic neuropathy. Diabetic neuropathy is a complication due to affected small blood vessels that supplies to the nerves. It is usually manifested as numbness, pain, tingling in the foot or hands. It is usually detected in the early stage with a test called monofilament test. It is a simple instrument with a filament to detect the affected sensations in the foot. If neuropathy complicates diabetes mellitus, it can result in ulcers, infections, and in severe cases, even amputations. So it is our duty to check our foot daily, and we have to give importance to the foot care. To summarize the things we have discussed so far, microvascular complications are very common but often silent. So it is our duty to detect the complications at the early stage and get the appropriate help from our healthcare workers. So what are the things we can do to stay healthy? First, we have to keep our blood sugar levels within the target range. We have to control our blood pressure within the appropriate range. We have to control our cholesterol in the blood. And we have to eat balanced diet. We have to stay active, and we have to do regular blood checks and eye checks at least annually, and daily food care. If you detect anything, you have to get the help from your healthcare worker. And don't forget that you are the important member of the diabetic team. Take care.